So tell us a little more where you are and what services you guys offer at your Coral Springs Dentistry.
So I'm surprised you said that because I do have a lot of patients that actually comes from the islands.
Oh,
I do have,
truly?
yeah, from Bahamas, from Trinidad, from Guyana. When they're visiting, they would always come and make stops here because they have like vacation homes here as well. So I actually do
Mm.
have a lot of patients from there.
So are you
Um,
saying that they would make an appointment before they come here and book their reservation or their appointment long before, or when they come here, some of them deliberately come to get their teeth checked out, right?
yeah, so we always recommend 6-month checkups and 6-month cleanings for a healthy mouth cleaning. So they usually make it, and we always make them advance. So we always make them like if it's a current patient, we'll make an appointment 6 months out for them for their checkup. So they usually do it in a way where they know they're going to be in town at that
Mm.
time. Hmm.
Okay, that is interesting. Very interesting. So I'm sure that our viewers who are looking at this program right now, they can definitely contact us at Alhikmat office to get more details about you, Dr. Sara Kareem. But could you share with them where exactly Coral Springs and some more services that you guys offer there?
Of course. So we are located in Coral Springs. It's in Broward County area. We are a multi-specialty practice, so I do have all specialties that actually come to the office. So I am a general dentist, so I do all of, your diagnostic checkups, seeing like where the cavities are, treatment planning, and then I also work very closely with my specialty to give patients comprehensive treatment that's needed. So, but you don't have to travel anywhere. You just everything's in one house. We yeah. Mhm.
Okay, go ahead. Go ahead. Yeah, yeah.
We also do same-day crowns, especially for patients that are traveling or they're visiting. We can do CEREC crowns in 2 hours. So you go home with a final crown in 2 hours. No temporary crown needed, no additional appointments needed.
Oh, that is interesting. Wow, that is really interesting. I'm amazed, and you guys take insurance and no insurance also.
Yeah, so for insurances, we take all PPOs and then we take some HMOs. But for cash patients, we do offer like discount plans that are better than cash prices. So cash prices are always high in dentistry. Insurances usually help lower that fee, but we offer discount plans. And then we also help patients make payment plans, and they can use care credit. They can use this. We have this platform called Smile Generation. It's a credit card basically that gives you like no interest payments for 12 months. So to really help patients get the care they need.
All right. So I mean, I know you are mentioning those technical terminology there, but for the regular layman down the street, could you explain like some of the things when people talk about a root canal and they talk about extract a tooth or extract their teeth, as the case may be? What are some of these detailed things that you guys do that the regular, ordinary Joe down there may be interested in getting done?
Okay, so majority of everything in dentistry, I would say, is preventative. So I would always recommend coming in early and getting your checkup. So you always want to take care of a cavity when it is small, right? So a small cavity needs a filling or like an inlay, which is like, we call it like a little puzzle piece that goes right into the spot where the cavity of the tooth is.
Mm-hmm.
As the cavity progresses and gets bigger, that's when you need more treatment. That's when like more invasive treatment's needed. Like if you're starting to feel toothache from it, when you're starting to get hot and cold sensitivity on a tooth, that means your cavity is starting to touch your nerve. So at that point is when you need a root canal and a crown to protect the tooth. So it is your natural tooth, it's just non-vital because there's no nerve there. So we can take the symptoms away. If you do not treat it properly, that nerve is eventually going to lead to an infection. And that's when you start hearing patients get like pus coming out or huge swelling on their face. It's because they're untreated infection that led to an abscess. And at that point is when you need to get that extracted. We also look at like the amount of tooth structure or the amount of bone that's around that tooth, if we can save the tooth or if we need to take the tooth out. So it's case by case, tooth by tooth, for the most part, but that's the overall way we look at teeth. Bone, around the tooth is probably the most important part. Is like the foundation of your mouth. So if you want to keep a tooth there for as long as we can, we got to preserve the bone and make sure we don't lose bone, which is periodontal disease. So that's probably one of the most common diseases that we have in dentistry.